today. It's a big day. It's one for which we're extremely excited. Today, Mississippi will initiate its vaccination campaign. This will be the next phase in our fight against COVID-19. We are extremely excited to have a vaccine that is not only extremely effective based on the clinical studies, but also seems to have a very favorable side effect profile. Now, to be honest, we know, and Dr. Byers and I and Jim expect that maybe we'll have some swelling after the shot and maybe even have a little bit of achiness tomorrow. But that's so much worth it. We know how deadly, devastating, and disruptive coronavirus has been for the state of Mississippi. So we look forward in the next several minutes to get the first COVID-19 vaccines in the state of Mississippi. Thank you, Liz, and I'll head your way in a second.
Dr. Dobbs, Dr. Byers, Jim Craig, and our esteemed guests will now get their vaccines. And we will try, like I said, to get as many different pictures for you and video as well and put it online. So at this time, can you gentlemen please come to the conference room?
All right, Lois, thank you. You normally do my flu shot.
I do.
Every year. All right, let's get reading.
Now, you guys, we're gonna slow this down too. So Lois, you'll kind of play along. Okay. So he can get singular shots.
Wow. First COVID vaccine.
Ready? Wait, hold on. How did it feel, Dr. Dobbs?
Felt like a butterfly. a little bit of sting, not bad.
All right, you're going to return to your office and let's go.
All right. Lois, thank you.
You're welcome. Dr. Byers, take the seat here.
All right, well, hey, good afternoon, everybody.
All right. Here we are.
All right. We're gonna go with this one.
Okay.
Yeah. How do you want me to do it?
I'm going to slow down so we can get this.
Okay. Thank you.
Okay. I forgot my stuff on this side. Okay. Get me. Okay, Paul, state your name and your title.
Hey, everybody, I'm Paul Byers. I'm the state epidemiologist at the Department of Health.
Oh, Lois, can you say your name too?
Lois Moore, immunization nurse.
All right.
Any questions? Jim, would you state your title?
Jim Craig, Senior Deputy and Director of Health Protection in Mississippi.
How did it feel, Jim?
She did an excellent job. Thank you.
You're welcome. You're fine.
Sonia Fuqua, Director of Clinical Quality for the Community Health Center Association of Mississippi.
How did it feel?
I didn't know she had done it yet.
Dr. Mayor,
So,
we gotta get your seatbelt off. Dr. Mayor, title, sit down.
Leandro Mena, Chair of Professor of Population Science, John D. Bauer, School of Population Health, University of Mississippi Medical Center. That's it's good, right? That should be fine.
How did it feel, Dr. Mena?
Totally painless. Thank you.
Okay, exciting. We've had the first 5 vaccines in the state. Seemed like it was relatively painless from what everyone said. I now want to throw this over to Dr. Dobbs, our state health officer, to start taking your questions. And Dr. Dobbs, if you would read the questions and the affiliate that the media is with, we'd appreciate it.
Yeah, no, absolutely. Thanks. And just can't tell you how excited we are to kick this off. This is a day we've been waiting for. And I'd just like to thank the team members who are here, the immunization program, which has done an absolutely fantastic job, and all of our partners. Someone asked, can we record this session? It's being recorded, so we can share a copy. Let's see. I'm gonna move on now to the real questions.
Dr. Dobbs?
Yes, ma'am.
It'll be on our website as soon as it's over, and it's rendered in the news and events section. And we will make all the pictures available as well.
Yeah, absolutely. So we have a question from Caleb Bedillion. Can we get any additional info today about the status of vaccine distribution to hospitals in the state? Yeah, you know, we have delivered to several hospitals, and Paul, you may actually have better visibility on kind of where we are. We know of 2 medical centers that received their distributions this morning and are planning this week to start getting their folks done. Paul, can you give us an update?
Absolutely. And yeah, we do have several facilities within the state that, if not receiving their vaccine today, will be receiving it tomorrow or Wednesday. Again, those are limited doses, but they are going to allocate those for administration to those frontline individuals that they've designated in their hospital that are the highest priority healthcare workers within their setting. Over the course of the coming next couple of weeks, we will be allocating and distributing additional doses of vaccine to hospitals throughout the state, again, to target those frontline healthcare workers. And Dr. Dobbs, I think you're on mute.
Of course, thank you. Sorry about that. Will daily vaccination data be added to the state's COVID dashboard or another website? I think once we get rolling and we start getting data in the immunization registry, I would expect that we'll give you regular updates. on the process and how far we are along in the vaccinations. Have a name. Someone asked name again, please. Lois Moore was the nurse who vaccinated us, and I think that's who you're asking for. So Courtney Ann Jackson from WLBT. What's the recommendation for those who have previously tested positive for the virus? Will those healthcare workers and long-term care facility workers, residents who have not had it, so let's start with the first one. So if you've had it before, you can still get the vaccine. Now, there is some guidance that if you've had it within 90 days, and it's okay to wait if you want to, but other than that, there is an expectation that healthcare workers will have it available, regardless, or other people too, general population, once that's under process, can get the vaccine anyway, because we know people can get reinfected even though it is uncommon. And then will those healthcare workers and long-term care facility worker residents who have not had it be prioritized? We're going to offer it to everybody within the long-term care setting. And I think that we are actually looking at going ahead and pull the trigger on the long-term care distribution today and start the process. Now, the vaccines won't be in arms immediately, but we have gotten information from our CDC partners that we should have enough vaccine to kick it off. So look forward to us, please look forward to us launching that initiative as early as later today.
And Dr. Dobbs, I would add that additionally, once we get those doses for distribution among the long-term care facilities, there should be adequate vaccine to go around for every single resident and every single staff and healthcare worker in each and every long-term care facility.
How many doses of each vaccine have been delivered? So far, we've only gotten Pfizer doses, and our first allocation is going to be 25,000. I'm not quite sure how many each of the hospitals have gotten. Jim or Paul, do you have visibility on what's in hand just yet? Everything's is kind of rolling out as we speak.
I think we'll see, like we said, over the course of the next couple of 3 days that we'll have the lion's share of that vaccine distributed, with more to come.
So from Ashton Pittman from Mississippi Free Press. I have a vulnerable family member that has asked children and grandchildren, including teenagers and college kids who are in school and work, to quarantine 2 weeks before Christmas so they can come over and have Christmas together. What would you say to grandparents like her who hope a strategy like this will make holiday gatherings safe? Well, I think it could work without a doubt, but I'll tell you, we haven't seen a single person, we haven't seen that to be a common practice in reality. And I think that you still would be at risk. As far as like a strict quarantine would be a little bit difficult, especially for young folks to maintain when they're, not infected or exposed. I think it could work, but I think we really just have to assume anyone we're around has COVID. We can't change that mindset. And we're most vulnerable to the people that we know and love because we trust them. We want to be close to them. So I think we'll keep the same recommendations of keep it small, keep it nuclear, keep it local. Keep it within your own family. Right now, we're too close to give up right now. And even when you're around family, even if it's close, family members, maintain space. And outdoors is always preferable. But I think we're going to still say keep it small, keep it nuclear, and keep it local. We don't want to have big Christmas parties lead to big COVID outbreaks, unfortunately. Oh, and Sierra Queen was from the New York Times. All right, so Steve Gagliano, News Mississippi. How will hospitals, pharmacies, doctors ensure that patients come back for their second dose and wait the appropriate time between? So there'll be a process. We will inform folks when they need to get their follow-up vaccination and get them an appointment. Now, there'll be different processes depending on where you go, right? So different clinics may have a different follow-up process, but for our processes and through our immunization registry, we do have an automatic a notifier that will let folks know when it is. And we actually have a process where you'll get like a text and a phone call reminding you it's time to come back. And for the Pfizer vaccine, it's 3 weeks. So all of us here today will look forward to getting our second dose in 3 weeks. Another question, does the first dose become ineffective if they wait too long? We don't know that very much. I mean, we do know that you need to have 2 doses to reach maximum effectiveness. A single dose seems to show about 82% efficacy after about 7 days. You would expect that you may have some waning immunity, but as far as with that second dose, would it boost you the full 95% efficacy? Maybe, maybe not. We just don't know. With other vaccines, there is some wiggle room, so you'd expect that within some duration of time, you're going to maintain full efficacy. How many doses did you receive? I think that's the same as the other question. We have 25,000 doses of Pfizer for the state, and then this is the, we had one vial we have with us now for this purpose, and we gave 5 doses at this press conference. Ronnie Mott, Vicksburg Daily News. How much of an impact will the vaccine have immediately or within the next few weeks? Mississippi is on track to have more than 60,000 new cases in December. This is a very important question. It's not going to have a big impact over the next couple of weeks. This is just the start. This is the beginning of the process. We will not have enough people immunized to affect population transmission. What we may have in the course of 5 or 6 weeks, or maybe even 8 weeks, are enough nursing home individuals and employees vaccinated to have an impact on that set of the population. And we may have some impact on people catching it in the hospitals, which is rare because we know people know how to protect themselves, but also to protect people who are working in the hospitals so that they can keep working, because our hospitals are absolutely packed, especially the ICU services where we are absolutely full, and we cannot afford to lose a single employee or risk additional ineffectiveness in our care for Mississippians. From Keisha Rao, Clarion Ledger. Will MSGH be releasing statistics on any adverse reactions throughout the state if and when they come up in real time or through a weekly report? We may have some of that information. Most of that goes through the CDC, so that may come through a different sort of mechanism for us to share. But certainly we don't have any qualms about talking about what people are going to experience. We do know that people can expect to have some arm soreness and feel achy, maybe a little bit fatigued for a day thereafter. So that's just part of it. But certainly it's absolutely worth it to get past this, the risk of having actual coronavirus. Ashley Norwood, MPB News. Which hospitals are on the list to receive doses? All hospitals, yes, all hospitals are on track to receive doses. Some hospitals, if they have proper storage and actually have enough folks who need to be immunized, will receive direct shipments from Pfizer because they can accommodate it. But most other hospitals, because they don't have the proper deep storage and don't have enough people to digest the entire 975 lot of vaccine that comes in a common package, they will get vaccine through us and our partnership with UMC to make sure that they get the proper number of doses delivered. So there'll be 2 different mechanisms. And I think that's the same thing. It kind of answers that last part of the question. What's the plan or concern for getting doses into rural communities? And so for hospitals, we'll be getting them to rural hospitals. Same thing for nursing homes, right? They'll get it the same way through the pharmacy partnership. And then when the time is right, we're going to have the COVID vaccine available through drive-through clinics, through numerous locations in the state, and then eventually in every county health department, so that people can always have it, besides the hundreds of people who've already signed up to be vaccination partners, whether they're clinics or pharmacies. Ashton Pittman from Mississippi Free Press. Dr. Fauci today said he expects it will be March or early April before people without pre-existing vulnerabilities to COVID are able to get the vaccination. Are you expecting that to be the timetable for Mississippi? Yeah, I think that certainly makes sense. But we hope to have a lot of people who have underlying medical conditions or people who are essential healthcare workers or essential workers of other types to be vaccinated. So if you think about that, vulnerable people and essential workers make up probably the majority of folks in Mississippi. So a large part of Mississippi is going to be eligible to be immunized well before this time frame. All right. And I think that's all the questions I can see, Liz, right now.
Okay, Dr. Dobbs, did you see the question? Because I'm not following the same way you are. Did you see the question from Ross Adams?
I didn't. Where is it? Let me see.
Okay, Ross is asking, how will hospitals decide which staff gets the vaccine first?
We have, by and large, left it to them to decide. But from our advice, we really want them to give it to folks who are at highest risk of contracting the virus because of where they work, like ER or intensive care unit or COVID unit, and for folks who are most critical staff who are exposed to COVID in this most intense period of the pandemic where we are absolutely overtaxing our healthcare system. So those folks need to be protected. We can't afford to have 3 nurses in an ICU out of commission for 2 weeks, not only for their health, but also for the health and the healthcare requirements that Mississippians are going to have. I'm just going to say it straight up. It's ugly right now, and it's about to get a whole lot uglier. There's no way to imagine that these thousands and thousands of backlog cases are not going to translate eventually into hospitalized patients and ICU patients. On average, over this pandemic, about 10% of cases have required hospitalization. We've seen mounting daily hospitalizations, and our peak has been, I think, 174 in a single day. And once they get hospitalized, they tend to stay there longer than your average patient. Well, we've been seeing 2,300, 2,600 cases in a day sometimes. So we see a real avalanche of folks hitting the healthcare system soon. So I just want everybody to understand that we're going to have a rough winter.
Dr.